Thank you, Ron, and everyone else for that warm introduction. Oh, get it over with, Jim. No, thank you for coming, or for asking me to come visit with you today. I was just going to kind of update you on what's going on at the medical center. Have some exciting news that I'm able to share with you today. Last night we had board meeting, and we have recruited another physician. He is a general practitioner, young guy. I think he's about 35 years old. He had been working our emergency room, very outgoing, likable guy. Staff kept coming to me telling me, Dr. Hicks really likes it here. You need to go talk to him, try to get him talked into coming here. And so I did. And of course I thought it was a long shot, and it worked out. And so he will be joining us around November the 1st. Of course, we've got a lot of paperwork and credentialing and things to get done. But what our plan is, we've been doing a lot of planning the last couple of days, is to put Dr. Hicks and Dr. Lawrence in the West End clinic where Dr. Kinsey was. That space is now available, and so we're going to move them into clinic together down there. Dr. Lawrence will be great support for Dr. Hicks, and that way when one of them's gone, they can help see each other's patients. And I think that will be a real help and kind of decrease some of the confusion in the front lobby with the whole urgent care going on and patients sitting there for Dr. Lawrence's clinic. It's been a little hairy up there, so I think that this will be a great advantage to get them down in a real clinic setting, and we're super excited. So trying to get a picture of him so we can start plastering his face all over the place, as well as another PA that I've recruited. Paige Little will be here at the end of January, 1st of February, again, kind of a licensing, credentialing thing. She's a physician assistant. Paige used to work for us and had always talked to me that she was going to go to PA school, and she wanted to come back. She liked working there. She loved Alva. She went to Northwestern, and you know, for me that was down the road, and here we are. I didn't think it would happen. So very glad to have Paige coming back to join us, and hopefully get her picture up soon so that you guys can see what she looks like. She is engaged to Sammy. I cannot remember his last name. Her name is Paige Little, but she is engaged to Sammy, I thought it was Krukenberg? Anyway, so she'll be joining us soon, so we're super excited about that. The downtown clinic has been extremely busy. They are probably hitting their capacity, and Gwen Holderby is going to have a baby in November, so that's going to put a squeeze on us. So we will try to have coverage for her being out, as well as there's been confirmed cases of flu already. So everybody, you know, we usually say don't get your flu shots. We usually hold off till October, so you've got enough coverage from when it really, you know, kind of starts hitting through early spring. But apparently it's here. We swabbed somebody Thursday who then turned positive over the weekend. So there were three confirmed in Enid, we heard last week. So it's coming. Strep has been ongoing. We never got rid of strep last year. People have tested positive for strep for a year now. So good hand washing, hygiene, cleaning of, you know, things that are used frequently, with bleach to kill all of that, those good bugs running around. We swear that we've got a new strain that's morphing, because people will come in that don't have a sore throat but just aren't feeling real great, and we'll swab them and they're flu positive. So, most people with strep have a terribly sore throat. So anyway, provider-wise, let me think if we've got any other news. Provider-wise, I don't believe so. We are interviewing several. We've got a position to fill in the emergency room. We don't like using locums physicians, particularly in the emergency room. We like to keep a steady staff that knows the people in the public, and so that you see familiar faces when you come to see us. So we are interviewing to fill a position in the emergency room at this time. What else? What questions do you have for me? Yes?
I see that the CEO of Bath Hospital has resigned and is moving to Hayes, Kansas.
Eddie?
Wondering if you were going to apply for the next job.
That would be no. That's easy to answer, but you could inform me. I did not know he was leaving. Lynn, that is too ornery of you to do. Next subject. What else? What questions do you have for me?
What are the hours of your clinic up there on the west side?
So Dr. Lawrence and Dr. Hicks's clinic, Dr. Lawrence is not in the clinic on Mondays, but otherwise he is there. His first appointment, I believe, is at 8:30. I think he takes his last appointment at 3 or 3:30. And Dr. Hicks's will run much the same, only he'll be off on Friday. So there'll be somebody in the clinic every day. The downtown clinic runs from 7:30 to 5. They are much like a walk-in clinic, typically. You can walk in there and get an appointment, except when it's really, getting flu season and strep and all that, they get pretty busy. And with them being down a provider, they've been... It's funny because I can look at their books and they may only have 2 or 3 people for that provider on the book to start out the day, but when you end the day, they've seen 22 people. So that's just how unpredictable it is. But obviously, our goal is to have enough providers in town to stop that out migration. We want enough providers in town to keep you here in town, spending your money here in town, using your hospital to keep the hospital doors open. That's the ultimate goal. That's what we want. And every little test that you can do to help support that helps us keep our doors open. Couple things, because I'll lose my train of thought and I'll come back. Couple things that are pretty exciting. They say don't count your chickens before they hatch. I'm trying not to on this one. In the past several years, we have tried at least twice that I can remember to apply for a critical access hospital designation. That gets you cost plus 1% reimbursement on your Medicare patients. We've never been, we had looked at that designation, I'm told at one time, when the auditors ran the numbers, it was better for us to stay sole community provider, which is what we are now. So we didn't take that opportunity then, and then Kiowa applied for it and got it, which then I guess prevented us from getting it, had been told through the years. We tried back when Dennis Shelby was the administrator. They tried to do it at that time and didn't work out, weren't able to, and so we revisited it, and I called the state trooper, Mr. Quick. Is it Brian Quick in Kiowa, the Kiowa area? I owe him a huge steak if this goes through. I called and talked to him one day and said, you've been driving these roads, and we had a long conversation. He wrote a letter for me, and then we have engaged Eide Bailey, which is an auditing firm, and together between the two of them, somehow, that we got a letter from CMS Medicare that says you do meet the qualifications to apply for the critical access designation. And I literally almost fell out of my chair. That could be a saving grace for our hospital. So everybody pray. We are in the process of doing, getting ready for a survey. We are going to pay a company to come in and do this survey because the state of Oklahoma, if we wait on them to do it, it could be 6 months or longer. So we're going to pay an independent company to come out and survey us. And if they say that we meet the qualifications for a critical access designation, they call it in our world a CAH, critical access hospital, a CAH. We'll be very happy. So that's one thing that we've been working on. Another thing I don't want to forget to tell you about is, all you men sitting out there, our digital mammography machine is up and running. We bought a new machine and it is in place and has been certified, and the staff have all been trained on it. So we're super excited about that. And one thing that I will add to that, since my little incident a couple years ago with breast cancer, when we switched to DIA out of Tulsa that reads our images, our radiology images, now when we send breast films, only a breast specialist reads those films. So that is a change from back a few years ago, when another company was reading for us, they were reading everything. So I think that's pretty cool. Do I think it could have changed mine? Quite possibly. It could have got me somewhere earlier. So I think that that's I think that that's a really good thing. And Allison's books are, she's like, Kandice, don't advertise this real heavily because I'm already filled up with women that have been waiting to come and do this because they want to do it here. So we're pretty excited to be able to keep that service in Alva. Very important. So we will be doing, during the month of October, is Breast Cancer Awareness Month. Anyway, we will be doing, getting together and working something up to put that in everybody's minds to be thinking about that.
I just wondered, in light of the current political situation, if you have contingency plans that you in the event that those funds those federal funds are no longer coming. Is there anything that can be done other than the critical care?
The critical access is federal funds.
Yeah.
If we were not to be able to get qualified as a critical access hospital, we will continue as a sole community provider. And that's, we were kind of talking at our table. You know, I think we've done a pretty good job of working as lean as we can, and we've kind of morphed into that over the years, you know, just tightening the belt a little bit tighter and tighter and tighter because we've had to. People taking on more and more jobs, wearing more and more hats, doing without, making things last longer, taking care of what you have. You know, you just learn to do that. The city, obviously, we still get tax dollars from the city. If it weren't for that, I think our loss this month was it 95,000 collectively? We got,
I think a little less than that, 79,000.
was it 79,000? We received, I think, 95. Anyway, rural hospitals are suffering. I mean, the state of healthcare is in a crisis, and they are in nowhere closer to fixing it anytime soon. You can read too often of hospitals closing. I suppose you see the same things I do. It catches my eye as well. It is scary. Share Trust has, I suppose it'll be in the board report that I gave last night, Share Trust helped us with the boiler project. our boilers were circa 19, when was the hospital built, 68 or whatever. They were the original boilers, and the state decommissioned them. They were no longer usable. It was a serious situation. And so we've been working on that project for about a year now, and just finally have completed that project. We have a bigger propane tank than Sam Long has down at the propane place, which is, state regulations. Somebody laughed the other day and said, yeah, I suppose you'll have to have a water tower now with all the hurricane stuff, which makes me really mad that they've had hurricanes. I got that doctor recruited, and I told Lynn if I got that doctor recruited that I was going to the Caribbean. Find somewhere else to go. If any of you know of any place. Anyway, no, I think we're very fortunate.
Let me mention one thing, which the critical access is just jaw-dropping, because I've been a reporter forever out there and seen them try to get critical access, and the killer, it seemed to be, was we were within 20 miles.
25.
Or is it 25 air miles of the Kiowa District Hospital, and that was, they're not going to duplicate within 25 miles. So when she announced it last night, I was, wow, the geography has changed.
Now the geography didn't change. What the problem has been all along, and I won't get this right, but maybe I'll get close, that the road between here and Alva from Alva and Kiowa that you would take has been marked incorrectly, and so they just, the 281 is marked incorrectly, so it is marked as a state highway, and it should be marked as a federal highway, or vice versa. Whatever it is, it should be the other, and that is what kept us from ever being able to do that. And if you'll look on the map, to redo that, when I looked at it, I thought, oh, this is not going to happen. If they would have to mark that, there's no logical way to do that. So when Mr. Quick, his name is Brian, when Mr. Quick was able to write the letter and tell of the obstacles that you would encounter, that you could encounter going from Alva to get to Kiowa Hospital, those were enough to give the exception. Trains, water on the highway. You think about trains alone. How'd you like to be laying in the back of an ambulance having a heart attack or can't breathe, and you're sitting there waiting on a train to pass? So, yeah, we're very fortunate, and we just pray that all of that will come to fruition.
Candice,
Somebody go first. Go ahead. Matt.
explain to me, please, what all are the advantages of being a critical access hospital?
The main, there's two things that I'm super excited about. So the main thing is, on your Medicare patients, you get paid cost plus 1%. Cost plus 1%, whatever your cost is, plus 1%. So, but that's only on your Medicare patients. So we will be focusing on that population and what kind of services we are providing, increasing those, increasing usage of those services, because let's take our emergency room, for example. If you look at our emergency room, and the Medicare use of our emergency room is, say, 64% of the people that come to your emergency room are Medicare, then we would only be able to attribute 64% of our personnel overhead costs, nursing. We could only take 64% of that and attribute it to that. So you want to you want to use your resources appropriately, because you're going to be you're gonna be reimbursed cost plus 1% on those. Now, the other payers, it doesn't matter, but that's why our Medicare population is so important to using the hospital services, because we will be reimbursed cost plus 1%. Another advantage of it is the swing bed program that we have. It reimburses really well, like really well. So we're going to steal our patients back from the nursing home and have them come over to the hospital to rehab, because the rate on that per day is going to be worth bringing them back over. So those are the two things that I'm really excited about.
Can I explain the discount that you now face as a sole provider for Medicare?
Say that again.
You might explain the discount that you have to.
Oh, like last night Kevin reported that it was like, basically we were being paid about 40 cents on the dollar. Is what
And cost
on our
cost
top.
1% of the other is
Yeah.
is the good news.
Yeah, that's how much our contractual is. Was we were being paid almost 40 cents on the dollar is what we're being reimbursed right now by Medicare. So you can see the difference that can make. Somebody else, what are you laughing about?
You look great in scrubs, but someone mentioned the other day they went in the emergency room or the urgent care or something, and
And I gave him a shot.
you were acting like a nurse, I guess.
Yeah.
She doesn't
Is
just
there
act
a
like
reason for that?
Acting like a nurse. I actually am a nurse. Let's
Well,
clarify that. I'm working on it. I will explain that. So last flu season, when things got so busy, we had so short of help because of what we're talking about, trying to make payroll, that it became inevitable that I had to go put my scrubs back on and I had to go work the floor. And so I went back through my check off, and I do still have my license, and so I went back to work, boning up on my nursing skills again. And what I discovered through that process, a couple of things through that process, the staff love it because they feel if I'm down working in the trenches with them, that I understand their plight much better. It builds a much better relationship between us, that they feel comfortable coming and talking to me about things that we need to talk about. And to be honest with you, my feet don't hurt as bad when I wear tennis shoes. No, and honestly, I have neuropathy left over from the chemo that I took. My feet drive me crazy. And so it just kind of all worked, that, and I do help in clinic a lot. When the nurses have to be gone and there's nobody to fill in, I'll go work. And I love it because I get to see all of you, and I get to give shots, and I get to, call the pharmacy, and I get to do patient care and give baths, I miss that. That's my first calling. And so when I get back there and do that, it fills a little place in my heart that misses that.
So you're on the floor then, are you billing that out as nursing rate or CEO rate?
See you. Do not put that into anybody's head. I'll put those heels back on. Of course you would ask that question. Anything else? It really has helped. I love I have moved my office. I don't know how long I've been up on the floor, Lynn. How long's it been? 2 years. 2 years probably. I had that office up there opened up, and I'm like, hey, I'm going to take that office part-time and kind of park up there, so that when patients come in that have issues or something they want to talk to me about, we don't have to come all the way downstairs. We can talk up there, and we won't have to run back and forth, and I'll spend a little bit of time up there. And it quickly became apparent that me officing up there is important, because people know I'm there, they drop in, it's easier for them to find me, talk to me. I hear, from staff more often. I like it. I like to be seen and heard and hear things going on. Just puts me in the know a little bit easier, because there's some days I would never make it out of the basement. So, have I talked too long? Arden's coming to get me. Any more questions?
Everybody needs to be a code reader. That's all, a code reader, you know, when you open up your claim,
A code
it's
reader.
got
Yeah.
like the date, you were at the hospital or at the clinic or whatever, and next to that is the code.
That means nothing
And
to
you
you.
look at it, you know, what in the, is this?
I know.
And then it says, it kind of gives you a little hint, like Dr. Kinsey or Dr.
On that day, yeah.
visit. But, you know, then it's the price, and then it's the insurance kicked in. But somewhere in the world, there's
An easier
a
bill,
class
right?
people take to hone up on being a code
Yeah.
person.
Yeah. You can Google it. It'll actually, Google CPT code and type that code in there and it'll show you what it is.
Huh? Did you put it in?
Yeah, you can Google it.
Google?
Yeah, Google it. It'll tell you what it is. It'll tell you what that description is. I do it. I still have to do it.
I didn't know that.
Yep. Google will tell you everything. Anything else? I appreciate you allowing me the opportunity to come out and visit with you and answer questions and tell you about what's going on. We're excited about the hospital and hope that when you come out you have a good experience, and if you don't, you know where to find me.